minute. Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate, and tonight we're going to be talking about booze. That's right, we're going to talk about alcohol, alcohol in your heart, alcohol and health in general. And it's really a big deal because uh, alcohol and drinking in general is so ingrained in Western culture. 57% of all adult Americans drink on a regular basis. It's a timely topic. And as a matter of fact, I found 3 articles in the last 6 weeks that dealt with this very issue about alcohol and the heart. So it's time to really have fun with this one. Now, first of all, is alcohol, and specifically red wine, is it really a French paradox? Where did this whole thing come from? Well, it's 1980. The French came out with a statement saying that we may eat more saturated fat than you Americans and Brits, but we may have higher cholesterol levels, but we have less heart disease and less mortality from heart disease. So that was an assumption. And then it came to America in 1991. It was presented on 60 Minutes. It became the big buzzword of the 90s. Oh, we should be drinking red wine and alcohol is good for you. And there were even a couple of explanations that were brought out as a possible reason as why this happens. Number one, we know that alcohol, specifically red wine, there's flavonoids or bioflavonoids or polyphenols. These are substances from plant sources, and they have a positive effect in so much they can help to decrease oxidation of LDL. Now, those of you that have watched me before know that LDL stands for lousy cholesterol, especially when it's oxidized. So what do polyphenols do? They help to prevent the oxidation of LDL. So it was assumed this is a positive effect from drinking alcohol, and specifically red wine. And the other effect is that it makes platelets less sticky, so that there's less chance for forming blood clots. Now, I want you to know those are the buzzwords that the French brought over, and it became important in the 90s here in the United States. However, these were never proven. It was never really, there was no randomization. So those people that are really into statistics call this whole French paradox thing a statistical anomaly, that it really didn't exist. So it's kind of debatable, but I think it's important to review the history. And so let's talk about the negative effects of drinking. And I think we always have to start off with the whole thing about drunken drivers and alcohol and accidents, because more than 25% of all of all mortality from automobile accidents are from drunken drivers. And that's 30 people a day in the United States. And actually, a person dies from an automobile accident related to a drunk driver every 30 seconds. So it's really a big deal. So, but let's talk about not the social aspects, but the health aspects of why alcohol may or may not be healthy. And I think the important thing is that alcohol really is sugar. Most forms of alcohol, especially if you're looking at wine and beer, are very high in sugar. And that's the last thing we need in this day and age, when we top the list of countries imbibing in sugar consumption. And as you know, sugar is a main cause of inflammation. So it's very important to remember that. And that's specifically true of beer and wine. Also, um, cirrhosis, liver damage. So one thing the French do have, they have a higher incidence of liver disease and a higher incidence of cirrhosis related to alcohol than we do. They forget to mention that. And the other thing is there's a higher incidence of cancer, specifically breast cancer, in people that drink and women that drink. So that's important to keep in mind. And I think other forms of cancer as well. Now, there's also a cardiomyopathy that we see in some alcoholics. Not terribly common, but I've definitely seen several in my career, in which the heart becomes enlarged and pumps inefficiently, and people develop heart failure, and it could be a lethal condition. Then we have the holiday heart syndrome. This is very interesting. These are people that are kind of like binge drinkers. They drink on occasions, and then within a few hours they develop arrhythmias or there are rhythm disturbances in the heart. It can be very disturbing, and a lot of these people end up in the emergency room with arrhythmias. So actually, alcohol can induce these changes in your cardiac rhythm. And then this whole thing about atrial fibrillation. I don't know if some of you heard me back a few months ago, but there was a study that came out in the European Health Heart Journal. It took place in this is Germany. Actually, it was led by the researchers in Hamburg, Germany, but it was actually a European cohort, and they studied over 100,000 people, and they found that even small amounts of alcohol, we're talking like 12 grams of alcohol, which would be like four-fifths of a glass of a wine or less than a can of beer, or perhaps a one shot glass of alcohol, which is not a whole lot. And that if you study these people, and there were over 100,000 people that they studied over a 13.9-year period, and they found that 5,834 actually developed atrial fibrillation. This is the big study that came out in January of this year. And the reason why is that we've known for quite some time that alcohol can actually aggravate arrhythmia, specifically atrial fibrillation. But we didn't really know it was a cause. And this is really a prospective study, and it monitored these patients for over 14 years, and those that drank heavily, or not heavily, actually these are modicum amount of alcohol, small amount of alcohol, actually they had a higher incidence of developing atrial fibrillation, which I think is important. Now, so what about this whole myth about alcohol being healthy, having its health properties? And these are also stem from observational studies, not randomized studies. And let's face it, they oftentimes would overestimate what moderate was. It could be a lot more than what they were saying it was. And there's also this problem with semantics. There's a thing called a sick quitter effect. I like this one, sick quitter effect. So do people are they do they not get sick because they drink alcohol, or do they stop drinking alcohol because they get sick? And these are important distinctions. That's called the sick quitter effect. But there really seems to be no protective effect that we have seen in any research from the effects of alcohol. So it's not a judgment. I don't think we can call alcohol a health food, you know. And the other thing I didn't mention is that the weight gain that goes on with a lot of drinkers. You know, you've heard the expression, beer belly or wine belly, but I don't think you've heard it with like a celery belly or a spinach belly, right? You don't hear it because those don't have the sugar and the calories that you get from drinking wine and beer. So what do? I treat it as an indulgence, and people like to drink, and like I said, it's very ingrained in Western culture. So there's nothing wrong with it, but again, it's an indulgence if treated in that way, and that's how you should consider it. Um, like if I'm at a dinner party and someone comes up to me and says, "Oh, you're a cardiologist. I hear that drinking is really good for you," or the French paradox. And I have a choice of two things. I could either say nothing, which I'm sure I won't do, or get into a discourse about why that's not really true and why it was a statistical anomaly about this whole French paradox. But, that's the bottom line about that. And I want to bring up a few studies because we all know that atrial fibrillation is on the rise because atrial fibrillation is a most common arrhythmia in those over the age of 70. I've talked about it before, both here on YouTube and also on in my blogs. It's so common, yeah, and with the aging population, we're seeing it more commonly. I mean, I easily see about 3 new patients every month with atrial fibrillation, and it's important because it's a cause of stroke. It can be because the heart is beating irregular. It also can lead to heart failure if the rate is not controlled. And it's also, this is a very important one now, is that it can lead to cognitive defects. Yeah, they've been shown now that people, if atrial fibrillation, whether it's persistent, whether it's paroxysmal, meaning it comes and goes, can lead to changes in brain matter. And who in the heck wants that? So it's a really important thing. So there was one, this is an important one. There was a study out of the UK. Looked at binge drinking. They looked at low alcohol consumption and whether it differed according to alcoholic beverages. It was published in the Journal of American Cardiology in last month, July 21st. They studied 400,000 people, and past drinkers and those with atrial fibrillation were excluded. And they were followed over 11 years, and they had the lowest risk was seen in those who drank the least amount of alcohol. And in England, that's less than 7 drinks a week. Now, I don't know how you classify that, but that's how they classify it, 56 grams a week. And the highest associated with beer and cider. Actually, beer and cider were more commonly associated with developing atrial fibrillation than wine. What about stroke and atrial fibrillation? I'm sorry, with alcohol. And there's another study that came out in June of this year in Korea, South Korea, and also published in the European Health Journal. And they found that there was a definite greater risk in those uh, that of stroke in those that drank alcohol, whether or not it was atrial fibrillation, and heavy drinking worsened. Heavy drinking worsened the stroke problem in those that with or without atrial fibrillation. So, indeed, the stroke risk can increase as much as 30%. 30% in those that drink on a regular basis. So it's not benign. Now, there's another study that came out in the UK. God bless this study. This is ridiculous. They said moderate drinking had protective effects against heart attack or stroke. And this is like less than 5 British pints of beer. I'm not really familiar with these British definitions of drinking, but they said there were those people that looked at the statistics said this is grossly wrong, overestimated. So this study has been pretty much wiped out. I even know how it got to be published, um, because they were underrepresenting heavy drinkers. Crazy. There's another study that came out. Came out in August 30th, this last week. That alcohol ups the risk for developing atrial fibrillation hours later after drinking. Now, so they took 100 patients, small study, and they wore these monitors, okay, that could measure alcohol levels, and they wore ambulatory EKG like a monitor for a month, which we do all the time in our office. And it shows that I got to read this, episodes of atrial fibrillation increased by 38%, 38% for every 1% increase in blood samples of alcohol. Um, so the twofold greater risk of developing AFib in a drink 4 hours after you have it. So it's pretty amazing. So I think it's unequivocal now, since I get a lot of AFib, and I've had people that drink with AFib. My answer is that if you have atrial fibrillation or if you have a propensity for it, you really need to think twice about drinking. Is it really worth the risk? Because it can certainly precipitate the arrhythmia, and that's what you need to know. And since this is on the rise, that's what I have to say about drinking and alcohol and health in general. So I'll take any questions people may have about not just heart health, but health in general as it relates to alcohol consumption. So please. Any questions? Oh, okay, good. Put my glasses on. Senior moment here. Does alcohol negatively affect COVID-19 outcomes in patients? That's a great question. As you know, I think drinking consumption has increased during COVID-19. Well, we know people have gained. I think the average weight gain has been like 21 pounds. People gravitated toward um, sugary foods, comfort foods, which generally be carbohydrates. And of course, alcohol is sugar. Um, so I haven't seen any reports on whether there's more adverse outcomes with COVID. I think it's probably increased frequency, but I don't think there has been. Haven't read any worse outcomes as a result of drinking. It's a good question, but I think I know that there's been a lot of people that have gone back to drinking when they were sober for some time, because this has been a very, very stressful time these last 15, 16 months. And of course, it's not over yet. So I think it's a big deal. But whether we're seeing more of an increase in health-related problems, it's hard to say. It's possibly because I just talked about four different studies that have come out in the last 6 months, and I was amazed. That's what I said. I had to talk about this because it's rare to see these many articles on alcohol in scientific journals. It's pretty interesting. Okay, anybody else? Okay, here's a good question. A lot of people ask, um, that people that have had a heart attack, um, and there's a vulnerable period after the heart attack. So a lot of people say, "Well, can I go back? When can I have my first drink? Can I have wine?" And I really, not based on scientific literature, but I think it's really prudent to avoid drinking for several weeks after a heart attack or a stent placement, mostly because it could aggravate an arrhythmia or could really cause havoc in that regard. Not that it would be damaging to the heart. We're talking about casual drinkers here or social drinkers. So I really am very careful about counseling people to not pick up their first drink for at least 30 days or so after they've had an event such as a heart attack or a stroke, mostly because of we want to avoid any like arrhythmias and things like that. And that's pretty much across the board for me. Okay, is a glass and a half too much with dinner? Okay. So what they normally suggest is if it's a woman, it's usually a glass. If it's a male, you can have up to two glasses. I don't know who made those rules, but that tends to be the general recommendations. So anything more than that is not good. But keep in mind that again, this whole thing about women, a lot of wine drinking and breast cancer is real, and that's a big concern to me. Okay. Okay, let's see. People get really red like me when I drink alcohol. What significance does that have? Okay, if you get really red, good question. It's probably rosacea, which is a condition. It's called acne rosacea, and so alcohol itself can aggravate that. So if that's the case, that's a trigger, and you might have to watch it, which is why a lot of people that do have rosacea really on don't do well with red wine. So you could probably go to white wine or perhaps rosé or other forms of alcohol. And by the way, although most alcohol beverages are laden with sugar but actually tequila is one that you can drink and has no carbohydrates in it at all. A lot of people that shun carbs will drink tequila, but that's tequila by itself without margarita mix. Okay, so that's an important thing. But yeah, if you tend to get red face, it's probably your body's telling you that it doesn't really agree with you. I think it's probably could be rosacea, could it be a histaminic reaction? If you just get red face, I think it sounds more like rosacea, but your body's telling you to back off. So, and you got to listen to your body. That's what a medical advocate does. They listen to their body. Okay. Thanks, Eric. I like these names. Pushy Reyes. It's great. Um, so we talked about alcohol after a heart attack and stroke. Um, again, I'm not for or against it. I think, like I said, it's an indulgence, and I think if used properly, you should be able to enjoy it. A glass of wine here and there, whatever you like. But you have to know that it isn't a superfood. So as long as you know that, and you can proceed with caution, then I think it's an individual decision as to what you do. My job is to say that it's not a superfood. Okay, I've heard that this is from Jonathan. I've heard that alcohol is damaging the brain. Thank you so much for saying that, Jonathan, because that's true. And I failed to mention that. There are now reports that saying that alcohol and not necessarily alcoholics, but alcohol on a regular basis can have a damaging effect on the brain, on brain matter, which is kind of important as we age. But then you've heard about people that live to 105 and they smoked a cigarette and they drank and nothing ever happened. I don't think that's the majority of people. I think most people are very vulnerable to the effects of smoking and drinking. But that is some new evidence, and thank you for bringing that out, that there is some damaging effects of alcohol on the brain, and with modest drinking. And I think that's important. Another negative that you need to consider if having a good brain is important to you as you age. Good question. Thank you. Okay. Oh, another great one. I love these. Okay. Seems every week one study says it's beneficial. Okay. Who do you believe? I would believe that it really isn't beneficial. It's an individual thing. And if you like it, do it, but do it with caution, knowing that, because the studies that I mentioned, there was one study that came out of the UK that I mentioned that talked about moderate drinking, and yet they grossly overestimated what that was. And they just, and people that have examined the study think it's a bunch of bull. Most of the studies that are really credible, that hit the peer review studies, have not shown that it is beneficial. And you got to remember, even those studies, some of the French Baronox era in the 80s, excuse me, and 90s, were observational studies. They were epidemiologic studies. They were not randomized studies at all. And so we don't have the data. There's no data that's saying this is really beneficial for your heart. And that's why I'm saying it's not a superfood. And you have to read these studies and really in great detail and understand how to scrutinize them, because it's not all cracked out what it's meant to be. But it's good to question this. Okay, tequila doesn't have sugar. Sorry, does that mean it is healthier to drink? Um, or to have an effect on the liver? No, I don't think it's healthy to drink. I just think that's one interesting aspect, that if calories are important and you don't want to get a beer belly or a wine belly, then tequila is pretty safe. But what I suggest doing all the time, no. I mean, it's still alcohol. It's still alcohol. So it can affect the heart. It can still lead to arrhythmias. It can still lead to brain damage. Again, it's taking the risk in your own hands, and I wouldn't drink with it. But it's just calorie sparing. It's not risk sparing. So I'm glad that distinction is important to make. Okay, let's see. Does alcohol affect various vitamins in the body? That's a very good question. Now, vitamins, there's I guess you mean the ingestion of vitamins. So, like, there's water soluble vitamins, and there's like vitamin C, and all the B vitamins are water soluble. Then you have your fat soluble vitamins, which is A, D, E, and K. Um, and I don't think alcohol affects the absorption. I don't think people are taking vitamins along with their alcohol. Kind of seems like an oxymoron, doesn't it? Um, does it affect intrinsic vitamin levels? I've never read anything about that. That's a really good question. I don't know if it would, because what happens, your B vitamins, you pee out. Same thing with vitamin C. What you don't need, your body gets rid of. The fat soluble vitamins are fat soluble, so they can hang out on your fat cells. So does alcohol affect that? It's a good question. I've never read anything about that before, so I'd have to really research it for you. So I will try to research it and get back to you. Great question. So I don't, like I said, I don't know. Okay, let's see. I'm not sure I've answered all these questions. We talked about the rosacea, the brain, um, the studies in general. I think that's it. We talked about the amount of alcohol that you could drink. Oh, good. I got another one. Okay, if alcohol relaxes someone, thereby releasing stress, would alcohol be good for that person? Actually, the answer to that question is probably no, and I'll tell you why. A lot of people like to drink because they can go to bed and they feel more comfortable sleeping. And I can promise you that if drinking before bed may make you feel relaxed, but it's havoc on your sleep. You do not get the deep wave sleep. In fact, it may hinder you from getting deep wave sleep, is what you really need for restoration. So I think people equate alcohol with relaxation and stress release. I would say there are a lot better ways to relieve your stress and to sleep than alcohol. So if you like alcohol, that's fine, but I wouldn't do it for that reason. I would try to find healthier ways, and we'll talk about that in future programs. We're going to talk about breathing and meditation and other ways of relieving stress other than alcohol. But it's a very common thing to do. It's a great question. It's really common. Great. Oh, let's see. Make sure I want to get all these questions done. I think. I guess that's about it. I'm going to just hang out for another few seconds here. I think we discussed this. Um, okay, I guess that's it. So, oh, good, good. Another one. Okay, alcohol and gout. Great question. Yes. Okay. And gout is this painful connective tissue disorder in which you have uric acid crystals actually crystallizing in joints. And alcohol can it's got to do with purines. And alcohol, especially, I think it's red wine, I'm so glad you brought that up, can aggravate a gout attack. So, and gout attacks are not something so benign. It's not just about another arthritic condition. It's a systemic condition, and now we know that people with gout can be predisposed to heart disease and hypertension. So, I always ask in my patients as part of their questionnaire, "Do you have a history of gout or a family history of gout?" Tends to be a family history. In my family, um, it's my father had it, my older sister has it, my brother has it. I'm fortunate I don't have it. I also don't really drink much at all, so it could be part of the thing. But there's you if you do have a history of gout or you want to avoid it, Google purines, foods that are low in purines, because that seems to be that will help precipitate that those can precipitate a gout attack. But alcohol is clearly one of them. Um, Thank you. You guys are asking really good questions. Um, so good. Okay. Well, we're almost out of time. And now I won't be here in 2 weeks because it's Yom Kippur, the Day of Atonement, which is most holy of Jewish holidays. So I won't be here. So the next one will be 2 weeks after that, which will be the very last Thursday in the month. There are 5 Thursdays in September. And we're going to talk about blood pressure because September is American Blood Pressure Month, and which affects the amount of blood pressure. The hypertension in this country has gone up exponentially. It used to be 60,000, 70,000 people in this country that have it. Now it's over a million just in the last few years. And so we're going to talk about that, and also we'll focus on natural ways of how to treat. But when do you have to go to pharmaceuticals? But when can we treat it naturally, and what can we do naturally to help with that? So I think we got everything. Okay. All right. Thank you, guys. Thank you so much for joining me tonight, and I will see you in 4 weeks. Okay. Thank you so much. Thanks for joining. Okay. It's kind of, I should have had things worked out, but that's okay.